Uh, Hello, everyone. Today is um, what is today? May 2nd, and we are having a fabulous office hour with our data analyst team. We have lots of information to share. One question to the participants: can you guys see the screen? The big screen that says EIC PMHCA office hour.
Yes.
Okay, awesome. All right. Um, and I'm thinking I'm going to give this up to my um, awesome colleague, Jan Donathan, who's a project manager for the PMHCA EIC project, and she will start us off. Jan, would you like to go over through the agenda?
Sure. So during the office hour, we have a couple things. So one, if you have any questions that you've brought with you, first and foremost, we want to make sure that we address those. So we'll tackle that first. On the latter half of the office hour, though, we'd like to touch on something that we've mentioned in previous office hours if you've joined us or any of our other webinar series. It's the discussion around an analytics portal that one of our partnering networks is creating or has created, and really trying to identify the opportunities for where PMHCAs might get involved in this. And then really just fostering some further conversation around that. Again, we don't expect you to, once we present that information, we don't expect a full bore conversation if you're not quite ready to engage, but just want to put that out on the table. So you can go to the next slide.
Mhm.
So before we dive into data portal specifics, I wanted to see if there are any questions from those on the call, anything related to either the data that you're collecting or as you're refining your particular goals and measures for your program, anything that you would like to ask of the group.
Miriam has a hand up. Go
Go
ahead,
for it.
Miriam.
Yes, so I am a PMHCA awardee in Georgia. We are currently in our third year of our 5-year grant year. And my question is going to be primarily seeking feedback from other PMHCA awardees on this call in terms of their experience and what they've done in regards to manipulating their data and storytelling in terms of program outcomes and progress. So with Georgia Mental Health Access in Pediatrics, we have 2 partners who are collecting our data, and on a quarterly basis, we receive an export from our partners, and pretty much we just synthesize and summarize all those reports they send over. And the data measures there primarily only fulfill the HRSA annual reporting requirements. So with that, our team has had a challenge in terms of showing the bigger picture. So outside of showing, okay, we've hit the mark in terms of how many consultations we'd like to administer this year, how many providers we've trained, what part of Georgia are they coming from? Are they in rural areas or not? What are they calling about? And it's very surface level. Are they calling about medication advice? Are they calling for a referral? What is the demographics of the patients that they're calling about? Nothing really further than that. And we've currently hit a roadblock in terms of how do we gauge to other individuals who don't know about GMAP why our program's a success, and even to our partners, how can we indicate to them that we've met our initial milestone, our initial mission statement of wanting to provide access to mental health specialties or services within remote or rural areas of Georgia that lack that. So that's primarily my question. So I was just curious to see what have the rest of you done in terms of storytelling with your data? How have you manipulated it? What are some measures that are not necessarily captured in our annual reporting that help to play a crutch in supporting your storytelling? And if there are some data measures that are already required in our annual report, which ones are those that you've used to leverage to support your program impact? I know that was a lot, but let me know if I need to provide any additional clarifications with my question?
I am happy to touch a little bit about one of the things that we've done that's not part of like HRSA required data that we gather, which is
Sarah,
anytime.
Sarah,
Oh,
quickly, can you tell us just which PMHCA you're affiliated with?
yeah, sure. So I'm with the Kansas PMHCA.
Oh, great. Thank you.
So we were established in 2019. So we're on, I guess, technically year 5 of our funding, first of our second, like our renewal. So we obviously collect all of the required HRSA measures, but then we also do like anytime we do recommendations from our mental health team to individuals that are calling in, we record that data as well. We published a paper a year and a half ago, I think, that was looking at the kinds of calls that we were receiving from our consultation line, and then the kinds of recommendations that we were giving those individuals. And it was an interesting story because, you get individuals that are calling and they think they just want help with like a medication question. And then oftentimes it's a much more holistic approach that's given to them. And so I think it really helped establish that like when they're calling in, they're also getting education on like a more holistic approach for whatever patient they were calling in for than they originally maybe even thought they needed. And so that was, I think, really insightful. So recommendations, I think, is a great one that you can maybe take some data on that's not necessarily a requirement for HRSA, but that can help further your story and like show your impact for the kids that are being addressed.
Could you give me like an example, for instance, like if someone's calling in for medication advice? Because we don't even, and we also get the diagnosis, but again, we don't even know if like what specifically about medication advice they're asking. Are you gauging some more context around that as well in terms of the situation at hand alongside the recommendation, or is it simply just, I guess, alternative measures outside of prescribing in terms of your approach to it being holistic, alternative measures outside of just prescribing the medication or the medication usage that is noted there?
Yeah, I think where ours is a little different is because almost all of our case consultations that come through our line are an interdisciplinary team that goes to those. So we have a psychiatrist on all of them, but then we also include child psychology on every single one of our calls. And so part of the consultation is any kind of therapy resources or referrals that is going to be added with those. So if we're referring to like be tested for like neuropsych testing or any other recommendations, that would be included on our recommendations form.
So recommendations would also mix with referrals in that case?
Yes. Yeah. Anything that we're going to that is like talked about during the consultation, whether that is, okay, we suggest a referral to this type of testing, or we recommend this type of resource, or we recommend this type of therapy be started. All of that is included, and then we can track that and kind of show like these are the top things that we're recommending to people when they call in for these types of cases.
Gotcha. Okay.
Yeah.
Thank you.
Yeah. And I'm happy to share that paper too if you're interested.
Yeah, that would be great.
Yeah, absolutely. I think it's on SharePoint, but I will see if I can add it in here. I don't know if I can add in the chat. I don't think I can. I can email that to you though, if you want to put your email. Yeah.
Thank you, Sarah.
Any other ideas for Miriam?
No, but I like, Sarah, that you mentioned just like beyond the initial performance measures, because they do a good job at showing like the reach of your program, but it doesn't necessarily demonstrate the impact of it apart from just counts. So I like that. And I think utilizing the providers you're working with, seeing kind of like what are the metrics that they're capturing, what does their leadership typically like. I know especially in the ED setting, we hear it a lot like, hey, we'd love to reduce our boarding numbers. And ED finds it a win when boarding numbers go down and readmissions go down. And granted, like, those are outside the scope of the performance measures, but those are value add impact measures. while, maybe those are a little harder to gather, those could be like self-report from providers if they're able to report to you that like, hey, boarding numbers this week have gone down. That's a good impact measure. So I like the thinking outside of the box. Any other thoughts from the group? If not, we can pull up the presentation. It's actually a good lead-in to the data portal.
Yes, let's do that. I was thinking we should do that as long as I find the share screen. It's my favorite part. There you go. All right. Can you guys see data collection tools and resources?
Yes.
Okay, next slide, I assume?
Yes.
Mhm.
All right, so I will let Amy introduce herself. Actually, Amy, why don't you introduce yourself?
Sure. So I'm Amy Barta, Manager of Data Science and Analytics for University Hospital's Rainbow Babies and Children's Quality Department. As part of that role, I am also the lead on analytics support for all of our quality improvement based grants that we are members of. So our big one is the Pediatric Pandemic Network, which Jen is going to give an overview of in the next slide. But we also support the EIIC, as well as FEMA Region 5 grant. So we have several that are under the umbrella of the Pediatric Pandemic Network that we provide the analytics support for.
Cool. So you can go to the next slide, Anna.
Okay.
So before diving in, we want to give you some context. Data portal, PPN, FEMA 5, you're like, this is a lot of acronyms. So we want to acquaint you with where this data portal has come from. So we partner with a larger network called the Pediatric Pandemic Network, and much to its name, its mission is really to collaborate with the nation's children's hospitals as well as their surrounding communities in an effort to really coordinate, prepare, and enable high quality, equitable, and research-based pediatric care specific to emergencies, disasters, and pandemics. So the focus is very much around those three things, all with the hope of improving health outcomes for children and ultimately their resiliency of children, their families, as well as the communities who are impacted by these emergencies, disasters, and pandemics. That's a lot of information to digest, but what's really important is really the story that we're trying to tell and the things that we're trying to do within this larger network. There are a number of children's hospitals represented on this map here who are all working together to improve the care of kiddos in the emergency care space, particularly around preparedness in times of crisis, et cetera. If you go to the next slide. So these are just kind of the overarching goals. A lot of this is kind of similar to PMHC work in terms of building those relationships with community entities. Again, PPN is focused on building relationships with children's hospitals, looking at local, state, and regional, as well as national emergency preparedness systems. PPN works to collaborate with community partners to address disparities and ensure health equity, improve pediatric emergency readiness across all healthcare systems, increasing capability of telehealth systems, and then accelerating real-time dissemination of research-informed pediatric care. Again, that's a lot of information, but it really goes back to demonstrating the impact of what we're trying to do. And what Amy is going to go into detail about is what we're calling a data portal, which is really an effort to try to create a centralized data platform where we can aggregate national level data so that other entities across the nation can access it. So it's no surprise that there are national databases out there, but pediatric info is really hard to come by. And if you do come by it, it's very sparse, it might not be updated. And so really what the PPN is trying to do is create that system of real-time pediatric specific information. Now, granted, right now it's much through the lens of, disaster preparedness, everyday readiness. But within the PPN, mental health and behavioral health is a huge component. And so that's where we're looking to incorporate additional data points that can really help drive improvement, as well as help tell a story of the impact that the work that we're having. So all of that to say, data can tell a really good story if it's meaningful data. So I'll let Amy take it away and introduce you to the portal.
Would help if I unmuted. So I kind of want to start with where the concept of the portal originated. And it was really around the idea of being able to effectively and efficiently host quality improvement collaboratives. So according to an article in BMJ, we can define that as an organized, multifaceted approach that includes teams from multiple healthcare sites coming together to learn, apply, and share improvement methods, ideas, and data on service performance for a given healthcare topic. So I think some of the stuff that you guys are already doing on a smaller scale right now, the goal of the portal is to really facilitate how do we expand that, not just within a region of a state, but outside of other states to really the national scale and get a lot more of our pediatric systems involved in these types of collaboratives. General benefits of participating in these national quality improvement collaboratives. Participants gain knowledge, problem-solving skills, and generally have a more positive attitude towards certain healthcare problems and wanting to address them. Great networking opportunities for other professionals and experts in the area, developing shared learnings and knowledges of effective practices in a certain service or topic. And the ultimate goal, which is improving the care that we're providing by applying the learnings that we have from these collaboratives. One of the challenges for expanding quality improvement collaborative outside like a local hospital, a lot of times it's participants lack resources or we don't have engagement from different hospitals. Part of the engagement barrier, I feel, is there's a lot of logistical challenges sometimes when you want to participate in these collaboratives. There's differences in care processes by different healthcare systems and settings. Obviously, there's always legal barriers and having to establish data use agreements when you're collecting data. And then trying to figure out how you can securely share and view data in real time to monitor your progress across the collaborative. So this often has required a custom application build for every collaborative, which takes time and resources to set up. I know the EIIC hosted a pediatric readiness quality improvement collaborative that took, I think, 2 years for them to build the portal just for that collaborative. The IPSO National Sepsis Collaborative has a data management and data portal site as well that took a while to get developed. And that's all really a barrier to kind of hosting these on a national scale. So the goal of the portal originally was to support, to kind of take down some of these barriers. Next slide. So the portal purpose was really to overcome some of these barriers to data sharing for these larger scale pediatric collaboratives, specifically reducing the time required to get the data collection systems set up and allowing different healthcare systems and organizations to be readily registered and be able to put data in shortly after joining the collaborative instead of having to wait around. But also creating more of a centralized resource for curated pediatric data sets. As we were talking about this, we kind of really thought, not just for quality improvement collaboratives, but collecting pediatric data in general. I mean, if you go to like federal websites or publicly accessible data sets, a lot of times the pediatric data is just not there, or it's very, very hard to get out of those systems because it's integrated with all the adult data. So there's not really good resources for pediatric data. So the goal here was to build this in a flexible way that we could host quality improvement collaboratives, but also host other projects like research projects that are multi-institutional or even operational type projects. So what we have developed is a secure platform to deploy and manage custom data and analytics solution. It's going to serve as our central repository for our Pediatric Pandemic Network members and affiliates, which PMHC falls under that umbrella, where data can be stored and accessed ideally under a single DUA. That's a part that we're working on right now, is having the DUA be part of our portal process sign up. So once you're signed up on the portal, anything you do in the portal, any project in the portal is covered.
What is GUA?
Oh, sorry, data use agreement.
Thank you.
Key functional characteristics that we have right now, we can support any cross-institutional data project. So that's what we're calling a collaborative. So really more than one site that's looking to kind of collect and share data together. So that includes our quality improvement collaboratives, research collaboratives, and operational collaboratives. So we do have some that we're actively getting set up now that are more around like surveillance data collection and surveys. So one of those, I know Jen had mentioned, ED boarding. Our Region 5 group has actually gotten all the hospitals to partner together to submit situational awareness data about like their ED volumes, their ED boarding on a weekly basis, so that they can kind of be monitoring for potential issues or look for high capacity problems when there's like a flu spike, that sort of thing. The projects are all rapid setup, fully customizable, and can support real-time reporting and analytics through custom interactive project dashboards. Next slide. Oh, you can click till all the bullets show. I'm not sure why. I don't know how those got in there. Apologies. So the current portal design and capabilities, before I demonstrate it, I do want to put it out there that this is meant to be a business application. So our core focus was supporting the functionality. So it's not the prettiest thing out there. It's not like a website-based thing. The design aspect is pretty minimal. Again, we have that support for customizable projects. Really everything can be customized. I've listed the features there. So any project information, supporting documents, all of that can be customized by the project sponsors. We have pretty robust data collection structure and forms, and we do provide specific support for PDSA cycles, the plan, do, study, act cycles that you use, and quality improvement. The ability to set up interactive reports and dashboards that meet the reporting needs of people. And then ultimately, as we start putting more and more projects on here, once people are registered for the portal, they'd have the ability to search for collaboratives or projects that they might want to be a part of and request approval if necessary to join those. It's fully HIPAA compliant. We are only collecting de-identified data, so any patient data that goes in has to be collected at a level that's not identifiable. I'm going to skip the security part. I think the part that I will call out there is we do have the option to integrate into your institutional single sign-on process. So we are allowing partners who set up their institution to use their own institutional logins. So you don't have to have another account and password. That's just really to facilitate the login and increase security. And we do put data security in the hands of the institution. So there's administrators for each institution who manage user accounts and user security and access. And there are some base notifications in the system available. Next slide. Last thing I'm going to throw up here before I actually kind of show you guys what it looks like, because I know this is very high level, kind of hard to conceptualize. The core activities that we have for our portal users, that would be our PPN members, our affiliates, so really anybody not on the analytics portal development team. Depending on the role that you have in the portal, you can have the ability to sponsor a project. So that would be you work with our portal team to set up your project. So all of the information you want, the data collection forms that you want, the reporting needs that you have, and then you have control over who joins that collaborative if you want to turn that on. So you can have control over which institutions are allowed to participate in your project. You can manage your institutional user security if you're one of those admins. So you can create users, deactivate users, change their security settings at any time. Search for projects to join. Again, we're still in our early launch phases, so there's not a whole lot on there right now and nothing in our production environment that is coming this summer. If you are a data manager for a project, you might be the person going in and entering data or editing that data. Several roles have the ability to view or interact with those project dashboards and the reports that are available on projects. Down the line, we'd like to be able to publish some data sets that people are permitted to download if it's appropriate. So finding data sets for secondary use to answer questions. And the feature that's not currently in there but is coming is community features. So really being able to collaborate and connect with other teams in the portal that are doing similar stuff. That's coming in a later version. So I will pause there. I think the next slide is just the portal demonstration. But before I jump into that, are there any questions?
Amy, will this be, sorry, go ahead, Jen.
No, go ahead.
will this be if our colleagues here from Kansas or Georgia would like to join this participation, would this be free for them? What's the price?
Yes, so as an affiliated member of the Pediatric Pandemic Network, yes, we want to have as many children's hospitals and children healthcare systems on the portal as possible. So it is free.
Okay. Go ahead,
Okay.
Jen.
Yeah, and just to kind of level set too, as Amy kind of walks through what the portal looks like, again, I think looking at this through the lens of, again, the performance measures that you have to already track on top of probably some additional impact measures that you're thinking of capturing. Amy mentioned quality improvement collaboratives. We're running one right now with PMHCA teams who are all working on different aspects of ED expansion and thinking of how it might be beneficial, a collaborative like that, having a central place where this collaborative can participate and partner with each other, as well as, you know, different institutions they're working with. It's another opportunity, again, to collate that information, but also share that information in one central place. Because I think a common thing we're hearing is that sounds great. We're doing something similar. Oh, that sounds awesome. We want to replicate that. Everyone's doing really great work that, again, differs state to state, but across the board, there's a lot of similarity in the work that you're doing. And so big picture, I think what we would like to see in the future is that if we can hone in on like key areas to demonstrate like improvement and impact and reach, that would be an excellent thing to design a collaborative very specific for PMHCAs to do something just like this. So that's, again, just kind of painting the vision as you're like, how does this relate to PMHCA? And then I hear PPN. So that's how we're trying to tie it together. Okay, Amy, I'll give it back to you.
Well, also in addition, I just want to just a few more points here that Sarah and Miriam, we are in the process of the collaborative, as Jen mentioned, with folks who are trying to extend their reach to emergency room spaces in their states. But the topics that are discussed actually during the collaborative is very much that the ones that Miriam pointed out. Additionally, how do we make an impact? How do we you know, celebrate the milestones with our programs and so forth? Who are um, who are those stakeholders that we need to involve, and how do we involve them? So I just wanted to say this is just an opportunity, and hoping, even though our project right now, the collaborative, is going to be coming to a hopefully not an end, but a mid milestone in September, there will be more opportunities. So if you guys are thinking about something like this in the future, just to plug in, think about joining going forward our EIC cohort. All right, I'm digressing. So next slide, yes.
No, I'm actually sharing my screen. I think, can you
Oh,
guys see
great.
it? Okay.
Yeah.
So I'm going to give a little live demo of the portal. So wish me luck that nothing breaks while I'm doing this.
Good luck.
And actually, I realized here, Jen, I probably need to get an updated copy for our developers to put on our portal because it's a little outdated here. So basically, if you're on the portal, you'd come and you'd select your organization to log in. So if I was to use my university hospital account, I'd get redirected to the university hospital login page. That would be the SSO process. Today, I'm going to use our Test Children's Hospital to demo a few things. And I do want to say this is our test environment. So there's, it's not the cleanest view right now because this is not real data. This is us testing some of the features. But I'm logging in as a data manager type role. So a person who may have view or edit access on data for the portal. So I'm here on my landing page. This is my Children's Hospital, Test Children's Hospital. And these are the projects or collaboratives that my hospital is a part of that I am permitted to see. So there may be other collaboratives that I'm not allowed to have access to, so they don't show up here. So that's part of that institution level security that admin role can leverage. So we tried to keep it very simple. So you can see here, we have several projects. The lock button indicates this would be one that I could freely join without sponsor approval. So anybody in the portal is permitted to join and start submitting data. Locked ones require approval by the sponsors before the institution is allowed to participate. You can see they list basic information like collaborative dates, the last time the collaborative information was modified or changed, the current status. So you can see I have a few here that are still in the recruiting stage, so there's no active data collection, a few that are in the data collection stage, and a few that are closed, which means the collaborative is done, the data is final. That might be a data set that I would maybe request to download for a secondary use purpose later on once we have collected more of these data sets. You can also see very clearly here, my access is very labeled, so I can see which ones I can edit, and I can see which ones where I'm only allowed to view data. I have no permissions to change or edit any of the data there. And base user notification system, you can see I have some notices up here. So I can go to my notice history, a few that I've read, a few new ones. This is a feature we're going to expand in the future, but it lets me know when I'm added to a project, and then also when that project has moved into data collection and I might be able to start entering data into the project. So there's a few options when you enter a project. So I'm going to go into this FEMA Region 5 Situational Awareness Surveillance. This is the one that I had mentioned earlier, where they are tracking things like ED numbers, flu rates, COVID numbers, boarding rates, that sort of thing for situational awareness in mainly the Ohio, Michigan, Indiana region. But you can see I'm very too simple. I can go in and view the information about the collaborative and see the data, or I can look at the project dashboard that is associated with it. So I'm going to go in here. This is the very basic project structure that we have. So this is not a PDSA cycle-based project. This is just a standard data collection project, might be a format for most of our operational or research projects. But you can see there's a number of information tabs here about like the background, the purpose, the specifics on the data that we're collecting, and then resources that people might want to see related to this. So these are all customizable. So that project sponsor can come in, tell us what they want to see on the tabs, down to how many tabs are here, what they're named, and the content. And we do have support, as you can see, for some nice designs. We can do images and hyperlinks and things like that. So this is pretty robust here. These three tabs are part of the project structure. So because project sponsor is a role in our portal, you can clearly see here who is a sponsor of this project. This is an artifact of the test environment that we have somebody named collaborative sponsor, but you can also see the documents that the sponsors may choose to upload. So this is like resources, additional resources, or things that may need to be shared that don't belong in one of these tabs. And then I can see who in my institution has what access. So this is just my institution's users. So I can see, like I have David and John, our colleagues who are only looking at data, but my collaborative data manager is also editing data, or actually that's my role here that I'm logged into. So key thing here is this is all 100% customizable. So this is the information you want to give to participants. This is the information that is visible if you were on the admin role and searching for a project to join or sign up for, you would see all of these tabs. And then data collection. These types of projects can have more than one form. So right now this project just has the one form, that's all they needed, but could have any number of forms here that can be filled out. I can go here and I can see I have records in here. So this is part of the HIPAA compliance. If we were entering encounter data or patient data where we need to track like medical record number or something like that, it is the responsibility of the data manager to maintain a mapping from our system ID back to the local ID. Just that's the only way we can keep it de-identified. In this instance, this is not sensitive data. This is just the situational awareness data. So I can see here, I have 3 records. I have one that was in progress. So I'm going to take a look at what I have going on here. So I can see just from a view, This is the data form. And again, all of this is customizable. So we support any number of data fields. We have text, we have dates, we have pretty much anything you can find in like a standard survey or REDCap software. It can get fairly complex. This has data validation in it. So I can require that an email address be formatted as a valid email address, for example. I can set, if there's ranges on, let's say, I don't know if there's ranges on ED volume, but if we wanted to say like someone couldn't put 1 million patients per week, we can set data validation like that as well. So that's the record. So if I was to go in here and actually come in and edit, so this is my edit access. The former access I just showed you was the view access. So if I wanted to come in here and start putting in my situational awareness information, I'm making up numbers here. These are probably not real. So I can add that. I can save my progress. You can see that I'm 67% of the way done with this form, but I'm not ready to finish that. So well, it looks like I answered all the required questions, so it marked it complete, but you can also start new records as well from this page. So I think really the main point there is, again, this is all customizable. And you can see that was the data validation kicking in there. And then I think the really cool thing about the portal is it's a very nice simplistic data collection structure. But what's really exciting is all of this data lands in a database that our analytics team can access. And then we have a tool called Power BI where we can build dashboards, and they're pretty customizable. So this beautiful dashboard was built by David, who's on our call here. And you can see that this is the data that was entered in that thing, and this is across everybody that's entering. So you can see I have partners in Illinois, Indiana, Michigan, Minnesota, and Ohio that are all entering data. If I wanted to look at just my data, I might look at the Ohio North region. You can see from that data, we're extracting the average ED volume in that region, the mental health visits left without being seen. I can change, pretty much anything can be filtered. So I can change how far back I'm looking. I can expand some of the tables down here to look more on a month or even day level for my COVID-19, flu, RSV, and flu A, which is what they're tracking respiratory infections, these 4 specifically. I have a nice map here, which can also customize hover capabilities as well to have additional information on things like this. And there is the ability as well to, really everything about this can be fully customized. So I have this first tab, but you can see I have even more tabs down here where I can display more information and reporting, again, all tied back to that data collection system that we had set up. And briefly, before I stop and take questions, I do want to show you guys what the PDSA cycle project looks like. So you can see it's very clear when it's a quality improvement PDSA cycle because it's got this nice little tag here. So if I go into Pediatric Readiness Quality Collaborative. So this was an example from the EMSC one that was hosted a few years ago. They have their, we have just additional data structure here. So same tabs, all customizable, and then the default tabs. We have information that's collected at the collaborative or site level. So that might be just background information about a participating institution. So this one, for example, is asking about the type of hospital, urban, rural, so that sort of thing. In the bundles is where you get your PDSA cycle. So the typical structure is you have a bundle that's focusing on a certain thing. And then there's PDSA cycles within that. So in this particular collaborative, one of the things they were looking to improve as part of this collaborative is ensuring that when kiddos show up to our EDs, we're measuring their weight in just kilograms. So that prevents things like medication dosing errors and things like that if we put it in pounds, because a lot of our system checks are based around weight in kilograms. So if I go in here, I can see I have this nice PDSA cycle structure. I have my baseline data that I can enter. This is the summary page, tells me when it started, when it ends, number of records. If I had documents uploaded to that specific cycle, those would be counted here. when I get into PDSA cycles, there's key drivers that you can select in intervention strategies. So those are typically defined by collaborative sponsors. And you can also put a SMART aim in. So if I was to close this cycle, and we're just going to say we ended it today, let's say I did not achieve my START aim. So I've closed that cycle. I can now start a new cycle, and you can see I have the start date. I can write up a SMART aim, and then I can select key drivers that are defined typically by the project sponsors. And then you can have any number of interventions that are defined by this project sponsors, but we also have the option for like write-in interventions, because not everybody uses the same intervention strategy for a key driver. But that's really just the support for the PDSA cycle structure. I just wanted to demo that, because if you're thinking more of like a larger scale quality improvement project, this might be a structure that you would potentially leverage. So I'm going to stop talking there and see if anybody has questions about this. And again, this is just the one role. There's a whole nother role that does user security and stuff like that, but I wanted to demonstrate the core piece here, which is the data entry and reporting.
We did have a question from Sarah. Sarah, do you want to speak to that?
Yeah, sure. So my question is just on kind of notification ability. So if I'm managing a project, is there a way for me to, let's say I have multiple people that are putting in data from different sites, can I notify them like, hey, reminders to put in data at certain times, or is there a way to essentially like message individuals that are on your team?
So that's part of the one of the future versions is to expand that notification ability. Because right now the notifications, you actually have to log into the portal right now to see those notifications. But we do plan to expand the types of notifications that we're doing. Would love to do exactly what you described, which is like an administrator or sponsor or manager could notify certain people. And we haven't talked about whether we actually want to generate email notifications or not. But the important piece is the infrastructure is there to build those pieces out. So we basically built these basic ones to get the infrastructure in place. But yes, the plan is for project sponsors to be able to send notifications of like, hey, we updated information in the project, you should go check it out.
Yeah. And this might be a silly question. So is this just for hospitals, or are we thinking like it could be for any type of PMHCA QI project in the future, or is it just for work that's being done in hospital spaces?
So the register, like it doesn't I think the intent was really to register institutions or what we're calling a site, but really the concept of an institution in here is just a group of shared users.
Okay.
So if that happened to be a collection of different people from various hospitals, and it was appropriate to create them as their own institution, we would get you like a local login would probably be the way to do it. Our goal is to get all of our PPN, EIIC, Region 5, and any affiliated partners. We'd like to get all those institutions registered on the portal under SSO because it's a little bit more secure, but we do recognize that it may not be appropriate. So pediatric hazard vulnerability analysis is actually a great example. That's a project where they're assessing their vulnerability to certain hazards, so like tornadoes or mass shootings. So they go through a form, but it's really a group of people that are from a variety of roles and institutions that would go through and fill that out. So when we set those groups up, they will probably have a specialized group. But yeah, really any shared group of users that should see the same level of data would be appropriate. The challenge there is you have to be careful on the type of data. So if you're entering patient level records, it gets a little hairy because we currently cannot restrict what you see within a collaborative for your own institution. So would probably want those to be separate, but I'm assuming that was not your use case.
No, I'd say generally, at least for our program, we don't take any kind of PHI or identifiable anything. So I don't think that would be a problem. But thank you. Appreciate it.
Any other questions or thoughts from the group?
If not, we have a few more slides.
Go for it.
Anna, can I ask you to pull the presentation up again? Look at you, you're already on top of it. So this is just highlights of if you have an institute, if you are an institution and you're interested in registering for the portal, benefits here. Again, I know you guys are still very early stages, but if PMHC was interested in leveraging this tool, it does provide a central secure location for those cross-institutional data projects, whether it's research, operational, quality improvement. It's a single place to manage if you're participating in PPN, EIIC, or Region 5 based projects. Again, the institution has pretty heavy control over their own data security. We do support those rapid project setups and customized reporting. And I think the most exciting thing is as we collect more data, that opens opportunities to do cross-project data set reporting and extraction. So down the line, we're looking to ingest publicly available resources that are relevant to the pediatric space. So that might involve pairing a QI collaborative project data with some publicly available data to do some more advanced reporting to get at the topics of interest. Next slide. I'm just going to leave this here for reference. This is just projects we're considering suitable for the portal versus not. So I think it would probably fairly obvious this is not a great system. Like it's not a Google Drive replacement. So shared file storage, editing, management, that's not what we're intended. And it's really meant to support multiple institution data collection, not just from a single institution. So I will leave these here for just consideration. Next slide. And then I just compiled a list here. When you are looking at smaller scale projects that maybe don't fit the portal, just some options for tools that you might use for data collection and analysis. Some of these are free, a lot of them are not, but these are ones that I'm aware of. Our EIIC analytics people could certainly help answer some questions about these if you have them. But just wanted to throw those out there that there are a number of tools to support, like if you're running small scale collaboratives or projects within your own institution or region. I think some of you are already using REDCap, I think, so you guys are probably familiar with some of these. And again, the consideration there is the type of data you're collecting. Obviously, if you have sensitive data, you have to go through your own institution's review process to make sure that whatever collection analysis you're doing is appropriate for the data. But just a resource for you guys to have. And that's all I had. I'm done now.
No, thank you, Amy. And so again, I think, again, it's available now, but the longer term goal for us as a technical assistance coordinator is that we would love, again, Anna mentioned that we are running a collaborative right now with 14 different PMHCA teams, I think 14, who are all, again, at very different places of their ED expansion work. But what would be fantastic is to create a quality improvement collaborative that lives in that data portal, where we can generate, or we can create some like predefined like bundles. And when Amy mentioned bundles, these are just like different like QI projects that you can embark on. And so like right now we've pinpointed like, and it's really tied to your performance measures, you know, teams are strictly, you know, actually all teams are kind of focused on all of them, but like a consultation-based bundle, a resource connection bundle, an education and training bundle. So seeing like how can we maybe design specific quality improvement bundles that can live in this portal and that we can get people within, you know, across the PMHCA who can be involved in a larger QI collaborative in there, all kind of working on the same thing together. So.
Well said.
And just to throw it out there to elaborate what Jen said, like when as you're thinking of like future projects or future funding opportunities, if you're looking to go on a more national scale, this is a tool that could be potentially leveraged.
I'm gonna launch. If you guys can see, can't see, tell me, a little evaluation. Did it pop up on your screen?
It did.
Great. I'll keep it open for a few minutes. Thank you for completing this. I'm gonna pause our recording and we can have a few more minutes for questions.